Hi, I'm Ashley Hogue, and this is for BSN 205. This is the wound dressing using sterile technique. Before I entered the room, I washed my hands with soap and water, but as I'm walking into the room, I'm gonna wash my hands again. And I'm going to close the curtain and provide privacy for my patient. Next, I'm going to introduce myself and verify my patient's identity with 2 patient identifiers and then checking their armband. So, hi, my name's Ashley. I'm gonna be your nurse today. I'm gonna take a look at your wound and we'll go ahead and change the dressing. Can you tell me your name and date of birth? And that is correct, that is their name and date of birth. I'm going to apply clean gloves to remove the old dressing. Okay, so I'm going to be pulling the dressing parallel, going with the direction of the hair so that we don't cause any pain. I'm going to remove this gently all around the wound so I don't accidentally pull anything open. All right. I'm going to assess the wound, do some gentle palpation around the peri-wound area, and then ask my patient, is there any tenderness? Which there's not, so I'm looking for the color, looking at the tissue, and I'm also assessing for any exudate or anything coming out of the wound. So now I'm ready to clean it, so I'm gonna dispose of the wound in my waterproof biohazard bag here. Wash my hands, and then I'm going to apply my sterile gloves to clean and redress the wound. I already have my sterile tray set up, so I'm going to apply the sterile gloves. Sterile. I'm just touching sterile to fix them. And then, okay, so first, this is my sterile tray setup, so I'm going to clean the wound, and I'm also going to clean around the wound, starting in the area closest with the exudate. And I'm gonna clean the peri-wound too, so I'm gonna make sure everything in here is clean. Next, I'm gonna take sterile gauze and I'm going to dry off the area around the wound before applying the transparent dressing. And I'm doing this gently, making sure to get any dead skin or remove any necrotic tissue. Okay, so now the area around the wound is dry. I'm going to apply the transparent dressing. Okay, and now that the dressing is applied, I will check my policy based on my location. I will put the date and my initials and the time that this wound dressing was changed. I'm going to remove my gloves, clean up my area, and then I am going to document in the patient's chart. and then check and see if my patient has any questions. And then I'm going to wash my hands as I exit the room.